All right. I think we should probably go ahead and get started. Just so you're aware, I have put in grades for your peer review of your urban community project. I've put in grades for your urban community project. I have not graded your advocacy papers. And this is very important. When you have turned in your advocacy paper, you can earn 5 additional points if you take a picture of the advocacy letter in an envelope. Take a picture with your smartphone. Take a picture of the letter in the envelope, the front of the envelope stamped, and it goes in the mailbox, okay? You need to mail it and send it out. And that is worth 5 points. So it's really up to you. Not everybody ends up wanting those extra 5 points, but it doesn't hurt. So you might want to just go ahead and do that. I only need one of you from each of the 13 groups to take a picture of the group letter in the envelope in the mailbox. Got it? All right, we're going to talk about mental health and health disparities. Sorry, I caught something, but I think this is our last lecture. The lecture on Wednesday is recorded, and so then your final is next week. You have a 12-hour window from 11:59 a.m. to 11:59 p.m. to take the final exam. Once you start the exam, do not walk away from your computer because you only have a couple 3 hours to actually take the exam. So sit at one point and take the exam straight through and submit it, okay? But I also want to say it's been an absolute pleasure to teach this class. You are all really amazing students. I was just so overwhelmed with how wonderful your presentations, your projects turned out. You've put a lot of yourself into the assignments, and I appreciate that feedback and that authentic voice that you used. And it's been an absolute pleasure to teach this class. I'm really feeling like I'm meant to teach this class. Originally, it was just I was a substitute for Dr. Morales-Chicas when she went on maternity leave, and I took over her class halfway through the semester. It was difficult because it's difficult to follow suit after a teacher begins the course. And so, I'm just feeling like I'm much more comfortable with everything now, and I hope you got something out of it. So, and the best part of this course is that you all are understanding, hopefully you're all understanding what it takes to advocate for yourself and the people around you, and the things that are not acceptable to you in your life. As a community member, as a participant in the community, you have a voice, you have a say-so, and you hopefully now know how to use that voice. So, so that said, let's talk about mental health and health disparities. I kind of didn't take roll throughout the course because you can't do that with recorded lectures. So I just, participation points are just going to be, everybody's going to get those. So, so don't worry about me taking roll today. So what's on our agenda? You'll need a piece of paper and pencil if you want to participate in the couple of idea prompts that I have. We're going to talk about mental health in the intro, make a list of barriers to mental health. Mental health, I'm going to do this lecture. You're going to have an assignment to do a stress test, and it's embedded in the lecture. And then you create a sustainability plan, okay, for yourself. There's a video, there's another piece on health disparities, and then a reflection on, COVID. So mental health. Actually, let me try to push this to full screen. That's probably better. At the root of the dilemma is a way we view mental health in this country. Whether an illness affects your heart, your leg, or your brain, it's still an illness. And there should be no distinction. And this is a quote from Michelle Obama. It's very inclusive. Whether you are on the spectrum and you have not just a deficit, but you have challenges that are not visible to the public, you still have challenges. And that can affect your mental health. If you don't see well and you wear glasses, that is a correction of a challenge that you face. Another quote by Claire Hughes: I had some experience in dealing with people who have mental illness and depression, but I didn't see the signs in myself. I couldn't ask for help because I didn't know I needed help. So that's a strong message, to be aware of the people in your sphere, whomever you share your life with, your family, your friends. Be aware of when something seems off and address it. Call them on it. Say, are you okay? You just don't seem yourself these days. Or you used to be completely up for, going out and having a beer on Friday or going to the movies, and now you don't want to participate in any of that. Is everything okay? Don't be afraid to put your hand out to help another. So what is a mental disorder? Any condition characterized by cognitive and emotional disturbances, abnormal behaviors, impaired functioning, or any combination of these. Such disorders cannot be accounted for solely by environmental circumstances. It's also called mental illness, psychiatric disorder, psychiatric illness, psychological disorder. There are many terms used, but it all kind of goes into the same bucket of mental illness. Some examples of mental health illnesses: depression, anxiety. People can get depressed if their paycheck is late. They can get anxious before the end of the semester because they have so many things due, or they may have unrealistic expectations of themselves and finishing the course all in A's or something like that. Another mental health illness: schizophrenia, bipolar 1 or bipolar 2, obsessive compulsive disorder, post-traumatic stress disorder. So how does mental illness get diagnosed? Physical exams. The doctor rules out a physical possibility for mental health symptoms. How would the doctor rule out any physical possibilities? Might do a CAT scan of the head, the brain, Maybe you had a concussion at one time. Maybe you have a benign growth or something. I mean, there are lots of different physical possibilities for mental illness. Maybe you decided to become vegan and you're not getting enough protein. I mean, it can be as simple as that. Lab tests, check for thyroid function, alcohol or drug abuse, psychological tests, where a psychologist would talk about your symptoms, your behavior, your feelings to determine any mental health illness or issue. And they might ask, how often are you feeling, do you have this feeling of being sad or not able to leave your bed? And it could be a physical anomaly. Maybe you caught, they're still doing research on long COVID and really what that means for most people. But it does create fatigue. And I actually just grabbed an article from about fighting fatigue. And it says you need to check your diet, basically, if you're feeling sluggish. You might have low protein intake. You need magnesium. You need complex carbohydrates. You need to have eating the rainbow, B vitamins, iron, potassium, CoQ10, which is an enzyme that is also an antioxidant. They ask if coffee can make you tired. And it actually, caffeine boosts energy levels, but it also can make you feel tired when the caffeine wears off. So those caffeinated drinks that people buy, they do have a downside. It's like having a soda and you get all amped up on sugar and then you have this slump afterwards. So be careful. Other ways mental illness can be diagnosed, specifications to diagnose each disorder is mentioned in the DSM-5. And that is that's a dictionary, sorry. Where is my DSM-5? Holy moly. Oh, here it is. This is the pocket version. It's the diagnostic criteria. It's used, it's put out by the American Psychological Association, and it's a book of all the disorders and their the billing code and so forth. But it's really what clinicians use to see if the criteria that a person describes falls within a certain category of mental health disorders, okay? So what triggers mental illness? There can be inherited traits. This means that it can be more common when blood relatives have also had mental health illness. Teratogens before birth, toxins, alcohol, drug abuse by the mother carrying the baby, environmental stressors, brain chemistry. If the brain chemistry is impaired, it can lead to depression and other emotional disorders. And there are plenty of risk factors, major life stressors like a divorce or death in the family, brain damage from injury, child history of abuse, use of alcohol or drugs, or just few healthy relationships in your life, history of childhood abuse. And that should actually be over here. Mental health in urban communities. There are risk factors. The financial strain in urban communities had the largest influence on parents' mental health. And in urban communities, you've got high rent, you've got transportation issues, you've got high utility usage, putting food on the table, bringing home a paycheck. That can all contribute to mental health issues. Violence in the neighborhood of an urban community has also had significant impact on mental health. The protective factors. Parents' pro-social support toward adolescents can protect parents from negative mental health outcomes. The more support the family and community provide to parents, the less vulnerable their children and themselves have been to mental health outcomes. I'm sorry, my phone is ringing, but I'm not going to answer it. Some statistics on mental health: 1 in 5 US adults have a mental illness. It's probably higher since we went into COVID. And the slide is from 2019, when in November, the first COVID case appeared. So an estimated 46.6 million individuals in the US had a mental health illness in 2017. I am certain it's much higher at this point. Almost 20% of all United States adults had a mental illness in their lifetime. Some additional statistics on mental health: anxiety and depression are in the 40%, depression in the 36%. They're the 2 most common mental health illnesses among college students. Nearly 3/4 of those with anxiety disorder will have their first anxiety episode by the time they're 21. And adulting is hard. It's hard. You have a lot of responsibility on your shoulders. You're trying to forge ahead as a young adult, and the world can be a cruel place, you know, especially when we've got an epidemic still in motion. Having a mental illness is associated with increased chronic diseases. So the more you can kind of like chill out, or whatever the term is, and do something fun for yourself, it's like good self-care, then the more you can ward off any chronic illnesses, like developing asthma or developing diabetes or things like that. So self-care is really important. This past year, the prevalence of any mental illness among US adults, and again, this is a 5-year-old slide, this is all broken down in percentages. Females, it's the percentage is much greater for females. Why is that? Probably because we can have children, and you know, there's always that scare that, what if you're pregnant when you don't want to be pregnant, or just, you know, there's a lot going on with our bodies, and with all of the other responsibilities and stressors out there in the world. The age range between 18 and 25, that supersedes, you know, 26 to 50-year-olds and 50-year-old plus. 1/4 of all the cases are in the young adult range. So life is hard. Life is really hard. And then Caucasians pretty much take the cake there. More Caucasians actually suffer from a mental illness of some sort, which is an interesting percentage. Mental health services received in the past year: again, females, 50% likely to seek services. It's actually not so much in the young adult range, but the older we get, the more established we become with having a family physician, or having services and healthcare insurance. And then it makes it easier when you have a relationship with your physician to book an appointment and say, something's not right, I don't feel right, and so forth. And again, Caucasians are dominating that service percentage. So this is where you want to get your paper and pencil out. Make a list of barriers to mental health. So why do you think women seek help for their mental illness more than males? Women's bodies, I'm going to just tell you, their bodies change with pregnancy and so forth. And it's more visible so it can be more acceptable. Postpartum depression has become more public. And so that is a reason for people, women to seek out mental health services. Why do you think individuals 50 plus seek services more than any other age group? And I think I might have mentioned that they have healthcare, they have established relationships with a physician. And at 50, there are lots of tests and things, colonoscopies, mammograms, things like that, that are free once you attain the age of 50. So it would make sense that you would go in for a well check and have these tests run and that sort of thing. So why do you think individuals who are white seek services for mental health illnesses more than any other race? I don't know if it has to do with less stigma or I don't know the answer to that. So it'd be interesting to find out what y'all write down. Does anybody want to share? Okay, then you don't have to share. Mental health stigma. It's social judgment, degradation, devaluation of individuals because they have mental illness symptoms, or they have been labeled as having mental illness. It's just a fact. People who look or act differently from the norm have all eyes upon them. It's just human nature. And it's not necessarily a judgment or a devaluation or any degrading perception. It can be curiosity. Like, what's wrong with them? It can simply be curiosity. But unfortunately, some people label it very quickly. Oh, well, they must have something wrong. Well, there are two kinds of mental health stigmas: public stigma and self-stigma. The public can be very discriminatory as a response to an individual's mental health or abnormal behavior. The self-stigma is the internalizing of public stigma about the mental health illness. Like, oh, I must not be worthy. Some of those examples, they are bipolar, they can't be in a stable relationship. Not true. Since they have high anxiety, I don't know if they can handle the stress of a real job. Not true. People, if they are seeking services for bipolar disorder or anxiety disorder, then they are no different than anyone else. That self-stigma is the part that goes all the way to our soul. If you have bipolar and the public is considering you unable to carry a relationship, then you might feel you're not worthy of love and attention or affection. If you have high anxiety and you don't know if you can handle the stress of a real job, then you might kind of have that self-talk that maybe you can't handle stress of work or school. So then you don't try to get a job, or you don't do as well in school because of that negative self-talk. You don't have to write down you don't have to deal with this scenario. There is a lack of cultural competence. The lack of cultural competence in mental health treatment can happen. Cultural competence means being able to relate effectively to individuals from various backgrounds. Competence must be the guiding principle. You are competent if you are open and embrace and include people of all walks of life. Okay, If competence occurs as a guiding principle, so that services are culturally sensitive and provide culturally appropriate prevention, outreach, assessment, and intervention. Mental health professionals must be familiar with the dimensions that make up an individual's identity, which can include gender, ethnicity, race, language, disability, sexual orientation, age, education, religion, and social economic status. Incorporating cultural competency by mental health professionals, we use open-ended questions to understand each person's cultural outlook. So we don't ask questions that can be answered in yes, no answers. It's much more open-ended. In other words, can you tell me a little bit about your preferences for treatments? Whether they want a group therapy or if they prefer individual therapy, things like that. Survey clients for understanding of their cultural competence. So how familiar are you with your family background? Is this something that that might run in your family? How open will your family members be? In other words, how supportive? Other questions: have mental health workers be fluent in languages of groups that they serve? This is very important. And when we can't be fluent in all of the languages that of the populations we serve, then we use interpreters, licensed, certified interpreters. We also have to understand that cultural biases of staff and program designs. And we try to banish all cultural biases of staff by trainings on a regular basis. You need to do your own personal cultural background history and understanding first before you can be open to all of the cultures that that you interact with and the services that you provide. And then we need to be able to implement culturally sensitive treatment plans. There are some examples here of mental health treatments by medication. There are psychiatric medications that influence the brain chemicals that regulate emotion and thought patterns. They're usually more effective when combined with psychotherapy. Psychotherapy can be done by psychologists or psychiatrists, and they apply research-based techniques to help people develop more effective habits, how to problem solve, how to talk about challenges, and how to counteract those challenges. And these can include cognitive behavioral therapy, interpersonal or psychodynamic therapy, and treatments that are either group or individual. Then there's group therapy, support groups and therapy provided in groups with individuals who have similar illness or traumas. There are residential treatment facilities for mental health residents. This takes place in a residential facility and where you live there 24/7, and you have monitored services. So you participate in group or individual therapy. You participate in medication administration, that sort of thing. It's part of the residential therapy plan. There are some celebrities with mental illnesses. You probably have heard or read about these. Chrissy Teigen had postpartum depression. The caption is, "I had everything I needed to be happy, and yet for much of the last year, I felt very unhappy." Leonardo DiCaprio has an obsessive compulsive disorder. He fights urges to walk through a doorway several times because he doesn't want his condition taking over his life. Sometimes people wash their hands a lot, or they, there can be other sort of things. Every time you pass a mirror, you have to straighten your hair. I'm not saying that those are completely indicative of obsessive compulsive disorder, but Kid Cootie, if I'm saying it correctly, suffered depression. Many other people have suffered depression. I've got some issues that nobody can see and all these emotions that are pouring out of me. That's the caption. Kanye West, we already know he's got really erratic behavior. He's been diagnosed as bipolar, with bipolar 1 disorder. He says it's his superpower. It's not a disability. He's a superhero. Well, that's his delusion. Lady Gaga has suffered from post-traumatic stress disorder. My own trauma in my life has helped me to understand the trauma of others. And many people have come out with, the traumas that they've experienced in their lifetime. Oprah Winfrey was repeatedly molested as a child by a family member. And that has plagued her throughout her lifetime, probably a reason why she doesn't have her own children. You just never know. There are counseling and psychological services available called CAPS, of course. Here's the number if you need to access that. As a student, you can qualify for 10 sessions of therapy. That's worth its weight in gold because therapy can cost anywhere from $200 to $300 for a 50-minute session. There is a stress screener here. I need you all to go online and do this stress screener. It'll give you a little love to Mental Health America. Sorry. It says, will you give a little love? No, that's not what we want. Oh, flip. Let me just click out of that. Sorry. So this is the Mental Health America screener. And you answer all of these questions based on 1 through 16. Do you find yourself eating emotionally, eating unhealthy? And you answer the question, next question. And so you go through all of these different questions, and then you can download the whole PDU or PDF. And here's the, okay, sorry. I'm just goofing around here. So that's the screener. Let me click out of this. I can't. There we go. So coping with stress. There is a video here. Let me see if I can tap into it. I can't. Dang it. All right. I want you to actually see that on your own, please. These are good coping skills for, or positive coping skills for mental health, emotion-focused coping skills, exercise, take a bubble bath, give yourself a pep talk in the mirror, meditate, problem-focused coping skills, work on managing your time, ask for support, establish healthy boundaries, learn to say no, create a to-do list, but not on your assignments. Don't say no on your assignments. Creating your own sustainability plan. And this is the homework assignment. On a piece of paper or on your computer, answer these questions. And then you need to submit it because it's worth points. Identify a personal external out of your control and an internal within your control stressor that might impact you while trying to work, okay? In what ways can you manage to regulate these stressors? What self-care practices can you put into place for yourself? So it looks like each of these questions might have a two-parter. Identify any difficulties you face in maintaining self-care practices, maybe like not enough time. How might you overcome these difficulties? Make more time. What activities and routines make you feel most like yourself? What can you do now to help yourself even when social distancing? Sometimes we don't always manage our stress in the way we hope. In what ways can you demonstrate self-compassion in these moments? So answer these 5 questions. Some are two-parters. And then make sure you submit that, upload it to Canvas. Here's the second part of the lecture. It's on health disparities. Health disparities means the differences in health outcomes and their determinants between segments of the population as defined by social, demographic, environmental, and geographic attributes. So health disparities. Okay, there's a YouTube video you can watch too. Now, let's see if we can try. Of course, there's a ad.
Among groups of people. Health inequities are differences in health that are avoidable, unfair, and unjust. Social, economic, and environmental conditions can affect health in a number of ways, creating health inequities. Social inequities occur when a person is treated unfairly because of things like race, class, gender, sexual orientation, or immigration status. Institutions, such as corporations or schools, have the power to create unequal opportunities based on social status. These unequal opportunities can lead to poor educational outcomes or fewer job opportunities, creating economic disadvantage. For example, a college graduate earns over $36,000 more per year than someone who did not finish high school. Income can determine the neighborhood you live in. The environmental conditions of a neighborhood can affect a person's health. In Marin, California, someone can live 15 years longer than someone who lives just 8 miles away. Why? Lower income neighborhoods tend to be in poor social and environmental conditions. Examples include being closer to environmental hazards, such as freeways or power plants, having higher crime or violence rates, or limited access to healthy foods and safe places to exercise. Social, economic, and environmental conditions can affect health disparities, which are differences in health among groups of people. Health behaviors affect disparities. If people are not educated on how to lead a healthy lifestyle, or they lack social and financial support to make healthy choices, they may choose certain behaviors over others. Behaviors such as smoking, poor nutrition, or unsafe sexual behaviors increase chances of developing chronic conditions or diseases, which can affect how long someone lives. Smokers live at least 10 years less than non-smokers. Health disparities are also affected by genetics. We are learning more every day about how our genetic makeup makes us more vulnerable to certain health problems. Access to quality healthcare is one key in reducing inequities and disparities, but health is more than just disease or illness. Health is how we treat others, the opportunities we are given, where we live, and our everyday behaviors. Nobody should be denied the chance to live a long, healthy life because of social, economic, or environmental conditions. To achieve health equity, we need to eliminate avoidable health inequities and health disparities. We need to create fair opportunities for health, provide equal access to resources, and invest in low-income neighborhoods. Health equity will be achieved when everyone is able to reach their full health potential.
To learn more, visit our website at healthequity.sfsu.edu.
Okay. There are some death disparity examples. Let's see here. It looks like in both male and female and Caucasian, they live just a smidge, couple months longer than all other races. Let's see, percentage over time. just, it's almost like it's capping out there. All races are catching up, or not catching up, but it's just it's evening out. So I think there have been a lot of really great campaigns about medications available. I mean, if you watch TV, it seems like every commercial is advertising some sort of medication. So the more the word gets out about services and medications available, and if I think a lot of these medications, they say if you can't afford the medication, contact the pharmaceutical company and they can help. So it makes it much more equitable for all individuals, all walks of life, to access remedies for chronic illness, or leading a better or more healthy lifestyle. Health disparities by demographic, according to race, why does it say Americans in diverse and racial and ethnic backgrounds experience higher rates of a variety of diseases and health conditions compared to Caucasian. I think that's probably African Americans. No, all Americans, I would guess. I don't know. I don't know why there's this typo here. I apologize. Women tend to live longer than men. They also tend to suffer more from disease and disability during their lifetime. Socioeconomic status. Americans with lower income and education levels report higher rates of disease, disability, and poor health compared to Americans of higher socioeconomic status. There's a reflection. If you think can you think of any health disparities that have been occurring since COVID-19? Access to testing. Luckily, the government has funded all of the booster shots, so that's not an issue. But if you need to get tested before you go on a vacation where you leave the borders of the state of California or what have you, that might be a situation of access. Social determinants of health, economic stability in terms of employment, income, expenses, debt, medical bills, and support, neighborhood and physical environment, that kind of housing, transportation, safety, parks, playgrounds, walkability, zip code, geography can be a determinant. Education, your literacy level, language, early childhood education, and how to monitor young children, and if they're growing properly, if they are growing according to the developmental milestones, vocational training, higher education, food, hunger is a big issue, access to healthy options, community and social context, social integration, if you don't speak the language in your community, then it's harder to socialize. Support systems might be harder to access. Community engagement, you may not feel comfortable or welcome engaging in community services. Discrimination, stress, and healthcare system. Health coverage, if you have it or you don't. Provider availability. Sometimes, I mean, I have a PPO and I can't get an appointment for raised blood pressure until 2023, and I'm not even talking about January. I called in October and they don't have anything available till February. Go figure. So that's provider availability, provider linguistic and cultural competency, quality of care. There isn't any. No, I'm kidding. Health outcomes, mortality. That is living or dying, morbidity, and those are health disparities, like what sort of risks do you have? Do you have chronic illnesses? Like if I have high blood pressure, that's a morbidity. Comorbidities, I have high blood pressure and high cholesterol. I have had family members die because of heart attack and high blood pressure. So I have comorbidities. My life expectancy is lessened. Healthcare expenditures, I have plenty of them. Health status, not so good, I don't work out. Functional limitations, I either have to get on board with going to the gym or cancel my gym membership, that sort of thing. Food insecurities, another risk. The disruption of food intake because of lack of access to food because of the location or financial reasons is a definite stressor. 17.4 million households were food insecure in the United States in 2014. I'm certain it's more like 25%. Food insecurity can be a long-term issue or temporary issue. Urban communities and low-income neighborhoods are at risk for food insecurity because they might have limiting access to healthy and affordable food, or the supply chain. Okay, we've had difficulty with the supply chain, and a lot of grocery stores are out of certain things. Sometimes they're produce, sometimes they're other healthy food options. Food desert, impoverished areas where residents are lacking access to healthy foods. An example, 99-cent stores, liquor stores, fast foods, no supermarket. So if you don't have the access, how can you possibly eat healthy? Then it's like it's whatever chips and caffeinated drink you can pull out of a vending machine. Having to take the bus miles away to access healthy food, that's a determinant. The food pantry on campus is still open for pickup at pickup locations, and please utilize it as a student, because you should be accessing the food pantry. It's free, or go online and fill out an application for CalFresh. As a student, you can get a CalFresh card in the mail, and then you have so many hundreds of dollars loaded on that card each month, so that you can go to whatever store and purchase food. Okay, so there's no excuse for not being able to eat healthy when there are food pantries available. Also, churches tend to have food pantries, and the availability of CalFresh for all students. So take advantage of it and make sure that you eat healthy. That's the one thing you can do to put good energy into your body, to get enough protein. The more vitamins and minerals that you can put into your body, the better off you are going to be in terms of immune system, supporting your own growth and health and well-being. It'll give you better sleep. It'll make you a healthier individual. So as a recap, mental health illnesses, we talked about those and how they're diagnosed. Talked about cultural competency, the mental health stigma, how to promote positive mental health, health disparities according to demographics, social determinants of health, and food insecurity. So this is our last Zoom lecture. I have a recorded lecture on Wednesday. If you have any issues of any kind, please email me. Please give me a call. My phone number is 562-933-8061. And I work late hours at the hospital, so don't be afraid to call. Sometimes I'm here until 9 o'clock at night or later. But the final is next week, and remember to turn in your advocacy letter and the picture of you mailing the advocacy letter, one per group. Okay. You've been an absolute pleasure, and I wish you all good things in the future, and keep in touch. Okay. Jessica, did you have a question?
Yeah, I don't know if it's just me, but when I was trying to submit the picture, it wasn't working, and I'm not sure if it's just my end, but if we do want to submit it through mail, then we'd probably have to do a double submission.
Well, can you take a picture with your smartphone? And you can actually email it to me, dfingerhut symbol
Mhm.
for memorialcare.org, or to my my email on campus, which is dfinger FINGER 4, the number 4 at calstatela.edu.
Okay, got it. And then the final, it'll be due at midnight, right? Or 11:59 that day.
Yes, yes,
Okay. All right.
yes.
Thank you. That's all I had to ask.
I think most everyone has done really well, and I'm so happy about that. It means that you were engaged in this course, and I know I'm not the most creative lecturer or engaging person to listen to, but I do appreciate each and every one of you.
No,
So
I think we got a lot out of it. I think it was a really interesting class, and I know you're super busy, so I really appreciate everything.
no worries. I took on way too much this semester. I'm teaching 8 classes and working full time.
Oh gosh. Oh, good
Yeah,
luck.
I
I'm
have no life, no social life.
Oh man. For the study guide, I was gonna ask, so that what we have, I see that it starts from week 8, it's the marriage. Is that like the same, just so I know what to study like from here on out, because I want to be sure I get the material. Like I'm gonna go through the study guide, but
So
I'm not-
which one are you talking about?
the study guide, I seen that it starts off with the marriage. So it says
With, okay, yeah, let me look, see.
Professor, in the meantime, if it's not too much to ask, could you enter your work email and your cell phone number in the chat just so that we can jot it down?
Can I put it in the announcements? Is
Oh,
that
yeah,
okay?
thank you so much. Yeah.
Yeah,
thank you.
because here, let me see if I can do it in the chat. I'm
If not,
afraid
it's
I'm gonna
okay.
lose everyone in the chat.
Oh, yeah,
because
no,
I've-
it's okay then. Announcements is fine.
Okay, okay.
Thank you.
So, all right, yes, it starts with marriage and cohabitation. Absolutely, it's not a cumulative final. So it's just from week 8, marriage and cohabitation forward.
okay, got it. Thank you so much. I appreciate it.
Jessica, did you have a question?
Oh, that was it. That was all I had.
Oh, sorry. Claire, do you have a
Okay.
question?
Can I talk to you after class?
Sure.
Okay, thank you.
Anyone else?
Professor, there is an assignment that is based on, it says readings, but I don't know that it says that we need to look at some links and that's it. But it is open, but there are no links in there.
Oh, which
In
link?
assignments. In assignments.
Those are all embedded in the lectures, any of these. It's just a kind of a reminder. It's like a laundry list of the things that you might need to be responsible for. Let's see, I think starting with the 5 languages of love, week 8 forward. So week 8, there was an assignment and that would be embedded in the lecture. So let's look back. So that's just kind of a laundry list of things to mark down in your calendar. So week 8, you have 5 languages of love. That was a submission link right here. Okay.
Okay, because I have my here. I have this open. It says reading assignments, and the instructions say please use the following links for your weekly reading assignments, and it says upload. But okay, got it.
Oh, did I answer your question?
Yeah.
Okay. All right. Anyone else?
Yeah. Can I stay after?
Yes.
I need to make sure my letter is correct.
Okay. I did actually, to be fair to everyone, didn't I not give you a sample letter? Here's the advocacy letter rubric and a sample letter to your elected official. This is the sample letter. Your address, city, state, the date, honorable, and that's what how you address a council person. paragraph, 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 and then sincerely you list your group names. Okay. So I need you to follow this. I'm not going to tell you that your letter is missing things, because that's not fair. Everybody else could have done that. Does that make sense?
Sure.
Yes.
So just make sure you follow this completely. Okay.
Professor.
Yes.
So I actually took the initiative of just removing the title where it says letter to, just the title. I did remove that and I posted it. I'm not sure if it's okay or not. I just think that if I have it there and, like, for example, I mail it, it wouldn't feel like as like legit. It would more seem like an assignment rather
Wait,
than it being.
but it's okay. You can tell you can tell your elected official that this was an assignment, that you're in a class. But you included sample letter to elected official in your letter?
Oh no, I just removed that bold piece.
Oh, perfect. Yeah.
Is that fine?
Yeah.
And I submitted it to on Canvas without it.
Perfect. Perfect.
Okay, great.
Yeah. But here's the template. This is the template. Okay. So I'm not going to review a letter before you turn it in. That's just not fair. And I wasn't doing kind of a rough draft. Does that make sense?
Yes.
Yeah, it makes sense.
Okay. Any other questions?
So just to be sure, Professor, you want us to take a picture like of an envelope of us mailing the letter?
Yeah, I know it sounds ridiculous, but yeah, that's just how you get the extra 5 points.
I just wanted to be certain. Thank you.
Yeah, it's kind of lame, but just go with it. All right. Okay, a couple people want to chat with me after class, so then I will let you all kind of log off, or whatever the word is. And I wish you well through the holidays. And if you're graduating, congrats. And if you're hanging in there until next semester to graduate, or you have a few more semesters, don't be a stranger, okay?
Thank you, Professor.
Oh, you're welcome, Javier. Thank you.
Great class. Really enjoyed it.
Oh, thanks. You guys are
Great work,
awesome.
Professor. The material is really interesting. So thank you so much.
You're welcome. Okay, let's see, a few more people are still online, and Claire, did you want to chat?
Yeah, it's about the final
Uh-huh.
for the OSD. I
Uh-huh.
don't know if it's gonna be a certain leak, or do I take it with everybody else because of my extension time?
You can take it with everyone else. I will make sure that you have the extended time, just like in the midterm. And so it's online. You don't have to go to the center on campus or anything like that, but you will have the extended time. Okay.
Okay, so would it be still due at midnight, or is it, I don't know how long?
Yes. If I give everyone 3 hours, then I'll give you 5. time and
Okay.
a half. Okay?
Okay. And that the finals due on the 12th, is that correct?
Correct.
Okay.
All right. Did that answer your question, my dear?
Yes, I have one more question. For the stress test, do we need to turn in a sample of what we got, the score?
No.
No, okay.
That's just all your own personal information. But you do need to turn in the sustainability plan.
Okay. Okay.
Good question.
Professor, I
Yes.
had a question about my group's PowerPoint grade.
Uh-huh.
If you remember, it was you were the one to grade us. We didn't have a peer review.
Correct.
Yeah. So when we turned it in, I don't know if you remember, you said that it was fine, that it didn't need any more improvements.
Uh-huh.
So I turned it in like that, but the grade says we got 25 out of 28. And there were no comments on.
Right, because I printed all of the PowerPoints off and I graded them over the weekend. You didn't include something that there should have been one slide with what you were going to include in your advocacy letter. Everyone else that got 28 points did include that, and it probably slipped my mind at the time. And I apologize, but you know, I didn't realize it until I saw everybody else's PowerPoints and they had included that.
Oh, okay. Yeah, then that makes sense.
Yeah, it's only a few points, 3 points.
Yeah.
So it's not a big deal. But you know, and I've been super generous with points and so forth. So
Yeah.
you know, I'm kind of worried that my wrist is going to get slapped because everybody's going to end up with an A in this course, and there's no variety. I mean, I don't know. The dean looks at that and it's like, well, what happened here? Did you just give everyone the same grade? So no, it's all good. And you know, there's a 50-point margin from A to B. So I think pretty much everybody's going to be getting an A in this class.
Oh, I hope so.
Yeah. So I wouldn't worry about the 3 points. And it just didn't dawn on me because I did peer review your PowerPoint and no one else's. And many of the other PowerPoints all included that one slide that said, this is what we're going to include in our advocacy letter. This is the issue. This is our possible remedy for that issue. And so that's kind of what they did.
Yeah, you're right. We didn't include it. I forgot.
No worries. It's not a big deal.
Yeah. Well, that was it. Thank you
Okay.
so much.
Thank you, Melanie.
Professor,
Yes.
I have one more question. For the reading assignment, there's nothing posted. So do we have to do anything for that? That's due on I think the 16th, the last day of class. don't-
Yeah, there's no reading assignment.
Okay, so we don't have to worry about that. Is that
No,
correct? Okay, so
Correct.
just the final and the,
Yeah, I'm looking real quick just to make sure I give you the correct information. Reading link, that's,
it's on the, when you click the dashboard. The dashboard.
well, this is a reading assignment for Wednesdays. And I clicked it and it popped up.
Okay.
So do you see, do you see here where it says reading link here?
Yeah.
So that is a reading assignment, but it's,
Oh.
yeah, I would familiarize yourself with this.
Oh.
Okay,
Okay, thank you. So, okay,
you're welcome.
just reading bunch
Yeah.
of stuff. Okay,
Yeah.
thank you.
You're welcome.
Hi, Professor.
Hi, Wayne.
I
I want to ask you a question. So throughout the semester, I've been in and out of surgery.
Oh,
So there's a couple of assignments that I haven't been able to get into. I want to know if there's a way that I can turn in late for less credit or however that goes.
do you know which assignments?
It is uh, it's a reflection.
The reflection?
Yeah, there's a reflection and a reality check that says missing.
Okay. All right, so I can open those back up for you. Can you get those in by next week, Friday?
Oh yeah, for sure. For
Okay.
sure.
I will go in and open those up, okay?
Okay.
All right, are you okay now, though?
Yeah,
Are you?
I'm actually, I just got on my wheelchair like last week.
Oh, heavens.
I'm recovering well though. Everything is going smoothly. I
Well,
just had to drop 2 classes due to it, but your class I've been able to kind of keep up with, like because it's more so virtual.
right.
So yeah, I'm
I'm
just
so
kind of
sorry. Well, I will open those up for you, okay?
okay. If can I email you if there's any more?
Sure, yeah.
Okay.
And I'm going to put that information in announcements as soon as we log off or whatever it's called.
Okay, thank you.
You're welcome. Take care. Be well.
Okay, you too.
Thanks. Okay.
I'm gonna head out too, Professor. Thank
All
you.
right. Be well. Take care.
You too.
Thank you, Professor. Thank you.
You're so welcome, Claire.
Oh.
Take care.
Thank you. Bye-bye.
Bye.